So diabetic retinopathy is the complications involving the eye. Diabetic nephropathy is the complications involving the kidney. And diabetic neuropathy is the complications involving the nerves. Hello, my name is Dr. Ganavi. I'm working as Associate Professor and Consultant Endocrinologist at Ramaya Medical College and Ramaya Memorial Hospital. So today we'll talk about what exactly diabetes is. Diabetes is a complex disorder which is mainly characterized by insulin deficiency or insulin resistance, which causes the blood glucose to go high. So it is growing at a very alarming rate, and it can be considered even as a silent epidemic. So at present in India, we have about 101 million people living with diabetes and about 136 million living with pre-diabetes. So which corresponds to a prevalence rate of about 11% for diabetes and about 15.3% for pre-diabetes. So as I said earlier, diabetes is caused due to insulin deficiency or insulin resistance. So insulin is a hormone which is basically produced by the pancreas, which acts at the level of the liver, at the level of the muscle, at the level of the fat, and causes the blood glucose to enter into the cells. So whenever insulin is not being produced in the body, or whenever there is resistance to its action, the blood glucose automatically rises up. So what are the complications which can occur because of the blood glucose rising up? So it can lead to numerous complications. It can lead to immediate complications, which are called acute complications, or it can lead to delayed complications as well. So the acute complications related to diabetes is nothing but there are mainly two disorders associated with this. One is called the diabetic ketoacidosis and the other is called the hyperglycemic hyperosmolar state. So these are two emergency conditions wherein the patients present with excessive thirst, excessive urination, and sometimes they'll go into a stuporous state or a comatose state as well. So any of these symptoms that the patient is having, like excessive weight loss, excessive urination, the patient has to, or excessive thirst, the patient has to report to the doctor immediately. So there are, as I said earlier, complications related to diabetes which can be chronic as well. So it can be microvascular complications, that is the complications involving the blood vessels of a smaller caliber, or it can be macrovascular complications as well. That is the complications occurring in the blood vessels which are of a larger caliber. So the microvascular complications related to diabetes include diabetic nephropathy, diabetic retinopathy, and diabetic neuropathy. So diabetic retinopathy is the complications involving the eyes, diabetic nephropathy is the complications involving the kidney, and diabetic neuropathy is the complications involving the nerves. So if at all, if any patient presents with any blurring of vision, floaters, the doctor has to be consulted immediately. Or excessive frothing of the urine, or excessive pedal edema, that is excessive swelling of the legs, or any facial puffiness, the doctor has to be reported immediately. And also if there is any burning sensation of the legs, any tingling, numbness, so again the doctor has to be consulted. So, and also the macrovascular complications to diabetes related to diabetes include the chronic complications related to the heart, that is the blood vessels of the heart can get affected, because of which it can lead to what is called as the ischemic heart disease, wherein there can be deposition of the cholesterol within the blood vessels, resulting in a decrease in the blood supply to the heart. This can also result in heart failure, wherein the functioning of the heart tends to come down. Also, there can be complications involving the blood vessels of the brain as well. This can result in stroke also. So the other complication is the blood vessels involving the diabetes causing the cholesterol deposition of the blood vessels of the leg, because of which there can be a decrease in the blood supply, which can result in gangrenous changes. So these are the complications related to diabetes. Hence, if there are any acute symptoms, or if there are any symptoms related to the complications of diabetes, the doctor has to be consulted immediately. So there are now very good treatment options available for diabetes, by which the blood glucose can be reduced, the complications related to diabetes also can be addressed. So if you have any problems, so please consult the doctor and take the treatment accordingly.